Cool. Okay, we might as well just get started. So welcome everyone who's attending. My name's Isaac. I'm from Manage My Health. So I work as a customer success manager in New Zealand. And I'm joined here by Jeremy as well, who's sort of my counterpart in Australia. So Jeremy, if you just want to introduce yourself.
Yep. Jeremy from Management Health Australia, implementation specialist.
Cool. And also we've joined by Tyson as well from Medtech.
G'day everybody, Tyson Somerville here, one of the business development managers here at Medtech Global. Really looking forward to today's webinar, bringing one of the longest standing integration partners we have, the team at Manage My Health. Before we get into things though, I thought we'd just have a look at where the magic happens and how Manage My Health actually fits into the Medtech ecosystem before passing on to the team here at Manage My Health to show you the great stuff they do. So here is our medtech ecosystem in all its glory. You can see here right at the very heart of our system is Medtech Artia, our latest gen practice management software. Of course, this is where your admin, your clinical notes take place, really the heartbeat of your operations, where you live and breathe. Of course, the data which is presented in Artia needs to be securely stored somewhere, and that's where our Medtech cloud ecosystem comes in hand, taking care of those updates, the backup and restore, and really any security compliance you need to be hosting medical grade data. Now, something you're probably not quite familiar with is ALEX. ALEX stands for Application Layer Exchange, and it's our API. In simple terms, this is a secure handshake between two bits of software. Handshake between Artia and any other third-party integrations. So you can think booking systems, AI scribes. It's what really makes us unique and your ability to build a system that really reflects your practice's workflows there. Now, of course, Manage My Health isn't a true ALEX partner just yet. They've got their own way of integrating into our system. However, as the products develop, they'll become ever more integrated going through that ALEX platform. But without further ado, I'd like to hand the stand back to Isaac and Jeremy to show off what we've got. Thank you, everyone.
Cool. Thank you so much for that, Tyson. And thank you very much, MedTech, for organizing this webinar and hosting us. Cool. So yeah, for starters, welcome. Obviously, we had the introductions before. So we're going to cover quite a bit of content today. We've got the agenda here. You can have a brief look at that. If anyone's got any questions throughout, feel free to drop them in the chat and we'll get through and respond to them as time goes on. And don't worry if you think we've missed anything. Definitely at the end, we'll have a Q&A and we can go through any questions you have. So feel free to kind of hold on to those or ask them as we go along. Cool. Next slide, Jeremy. Yep. So obviously within Australia, the primary care landscape is changing. There's a number of different challenges that clinic owners and administrators are facing at the moment. Obviously, there's significant admin pressures and rise in operational costs. Margins are getting tighter. With inflation, costs have gone up significantly for most businesses, in particular healthcare. There's an increased demand for patient services, particularly digital ones. We saw, obviously post-COVID, there was a significant rise in the likes of telehealth and people having more immediate access to their healthcare records. And this demand hasn't decreased. If anything, it's increased further. The expectation from patients is higher around having access to things at the right time when they need it and being able to sort of access telehealth services through their GPs. This is becoming the kind of the new standard. Obviously, another challenge as well with continual patient contacts, particularly around booking and the admin side of things. There are risks around aggression to staff and more pressures because patients may want to get booked in as soon as possible. This may not be practical, and then the pressures put onto the staff in order to kind of communicate this to patients. And then obviously the challenges that then come with working in a high demand environment where you're under these kind of pressures with retaining those staff. Because there's nothing worse than having someone that's competent who does a great job, but they feel that they're overworked and unsupported, and they then end up leaving the role. So, as with all these things, we believe at Manage My Health that the services we provide and digital tools in general, particularly effective ones, are a really good solution to these problems. Reducing admin, being able to protect your revenue stream, and overall improving the patient experience. And this is critical when it comes to retaining patients and getting them to come back. Cool. Just the next slide, Jeremy. So, introducing Manage My Health. So, some of you attending may have heard of us before, some of you may have not. So, Manage My Health at its core is a fully integrated patient engagement platform that integrates directly with Medtech Artia, and it's designed particularly to ease the administration burden on practices by providing specific tools and features that help with these common sort of admin processes. So, just a few things that patients can do: booking appointments, managing their repeat prescriptions and being able to request these, receiving recalls and reminders, accessing telehealth services, communicating securely with their clinician, and also being able to pay for these services online. And as I said before, all of this connects directly with Medtech Artia. Cool. So Manage My Health has a background in New Zealand originally, where it was founded. So it's built on a proven platform in New Zealand. We've got about 700 practices that are utilizing MMH and MedTech practices, and over 3 million patients are enrolled through the service. We can access it. You know, and we're long-standing. Manage My Health has been in the market for a very long time, with significant uptake in New Zealand. So we are the leading patient portal in New Zealand, and we have relationships with most of the large government and sort of public sector health groups, as well as the largest private groups. So there's a significant number of companies that use, rely, and trust Manage My Health services. And we're now, rolling this out within the Australian market. So we've already got some early adopter clinics, and this is a bit of a phased rollout. And obviously now we're looking to do a push to do a full rollout. And as with all of this, we've got that full integration built in. So that's one of the main things we think is critical is obviously MedTech is bringing out some great features for the Australian market to support them, and we want to be complementary to that and, obviously support them with their sort of rollout in Australia as well. Cool. So obviously what we discussed before, how can Manage My Health enhance your MedTech art here? So, we believe as a software, it's not something that's going to replace anything to do with MedTech, nor is it likely going to replace anything in your existing workflow or change things too much. So there's a number of different workflows that we can kind of improve by streamlining them. So I'll go into more detail with some of these specific workflows, but the key ones probably is appointment booking, which I'll expand on in a bit, being able to share results and documents. So being able to pass through results to a patient directly into their portal rather than having a multi-step process of perhaps, administratively scanning it, uploading, then sending it through the patient and all these different steps. Being able to remind patients about recalls digitally, recalling a patient back to your clinic if you need them to return for something, and being able to obviously automate this process. So MedTech does offer these features, but we can build on that by contacting them directly through their Manage My Health app. Same goes for prescription renewals. So being able to kind of automate these processes, patients can then send those requests through and they can prepay for them as we discussed. Also secure messaging, which I'll build on in a little bit. And obviously, again, collecting that prepayment. And all of this data writes back into Artia. So particularly with things like appointments, there's a write back service that's built in that will write back into this. You don't have to do any manual processes here. The idea is that it'll work in the background and all of these different workflows will happen seamlessly without you having to intervene. Obviously, specific features like, say, prescription requests still require an approval component from a clinician, but the idea is that all of this will sort of happen in the background as a complementary service rather than something you then have to access and kind of manually put inputs into to get these responses. And also, probably one of the key benefits, because we've got this quite tight integration with MedTech and because we've worked with them for such a long time, we've built our workflows around theirs. So the workflows that we've created, as I mentioned before, are not, significantly divergent to what you've already been doing or what your admin or sort of clinical staff have been doing. So the processes are really straightforward and none of them are very foreign. There's very limited training that's required in order to get up to speed with things like results and scripts and all of that sort of stuff. It is very much in the native workflow. So there's minimal complexity, and we think that's a real advantage to Manage My Health over a lot of the competition. There is significantly less complexity in not only getting it online, but then using it as well and using it effectively. Cool. So one of the workflows I wanted to talk through is obviously the common one of appointment booking. So as it would stand currently, and I get for some clinics this may differ, but a patient would call the clinic, they may have to sit and wait in a phone queue. Reception then will get the person through. They may have to validate who that person is because people share phone numbers or they may not have caller ID on. They've then got to find a suitable time in the appointment book. They've got to enter the details into the PMS, And then from that, the obligation is on the clinic to not only manage, confirming the appointment, sending reminders, and then also probably cancellations as well. And if they make any mistakes in the process, all of that is on the clinic. The admin staff there, if they make any mistakes, that's on them. With Manage My Health, the way we can change this is you're presenting the appointment book and, all the information respectively of it to the patient within their portal. They can then pick the appointment type that they like. They can select the time and the date. This information is then written directly into Medtech Artia. Confirmations and reminders are sent automatically, so these can be configured to your liking, and we can set, the timings for these and when they go out, but there's no thought that has to go into this. It will happen automatically. This frees up reception or administrators' time in that you're going to have less cancellations in terms of people forgetting their appointments or not being able to attend because they're booking these, but also they can then cancel themselves without an additional touch point from reception. No longer will people have to email or call in. Perhaps that gets missed, or they just don't show up. They can go on their app and they can choose to cancel it within a time that you choose to configure. Same goes for obviously them being able to book and the sort of appointment types we can present. Cool. Jeremy, if you just want to go next slide, please. Cool. So another area that Manage My Health really stands out in as a strength is our telehealth systems and abilities. So when a patient's booking, they can also choose their specific appointment type from the list that's available. So we have the capability to offer 3 different appointment types within Manage My Health. So either a visit, or phone or video consultation. So you can have the different choices here based on the flexi appointment slots. Patients can then select those. So one of the really cool things with Manage My Health is we have our video consultation service. So when a patient is looking to book a video consult, you can provide instructions as per the video consult and how they can kind of go through the process of joining that in Manage My Health. From the clinician side of things, there's a button there and a QR code. They can use their own device if they'd like to, rather than having to use a separate piece of software. So it's all sort of built in, but the benefit of, say, the QR code that I mentioned before, they can scan this and without having to log in, they're able to then have a video consultation with the patient. So this is a real advantage over some other services where you may have a separate thing you've got to log into on a different device. And then obviously the added challenge of they may not have a video camera on their computer. This may not be functionally possible. So we're kind of allowing clinics that prior were not able to offer a telehealth service because perhaps, they didn't have webcams or they felt their computer was too old. Now you have this easy system of allowing patients the flexibility and the choice to book a telehealth service if they want to. They can book in that video or phone consult, but also the fact that from a clinician side of things, there's no excuse as to why they couldn't use a video consult because it's very straightforward. If they're familiar with the portal and with MedTech, there's no additional challenges here. And then from a patient side of things, it's seamless. They're making the booking through Manage My Health, they're getting the reminders through Manage My Health, and then they're attending the video consultation in Manage My Health. So you're not having to send a link to an external provider or a different service and going, hey, you booked it here, but you've still got to go jump on this website or make an account for this service in order to access it. And once you build that familiarization and that simplicity, patients are going to be far more likely to continue to come to your clinic because they know they can book online and they're familiar with the platform. And it's so easy that anyone can do it. We've got people here in New Zealand that are elderly and have no challenges booking online. And a lot of people really like the flexibility that it gives them to be anywhere. They can be at work. If they're pressed for time for an appointment, it may be something that's fairly straightforward. And it removes that barrier and improves that health equity when it comes to being able to just book an appointment. Because again, in this day and age, I think people are much more accustomed to being able to do things online. And often are more short on time. So we're removing those barriers and helping them get on there. So some key benefits. Cool. Next slide. So another kind of neat feature in the telehealth vein is secure messaging. So secure messaging as it stands is somewhat like email in terms of the type of communication that you're doing. It's text-based. Within the portal, patients can compose messages and clinicians can do the same. So you can basically have a back and forth. Clinicians are able to generate them in the practice management system. Patients can do it in the portal, and then you can communicate. These are also configurable in terms of how you can set them up. So you could have one-way communications that come come from, say, an admin staff or a clinician. A common one we see is often with a result, a clinician would send a message to a patient saying, just be aware this result has come through. Do not be alarmed by, what you're seeing there, etc. Same goes for sort of simple issues that clinicians may, be comfortable communicating with the patient. We can put different information around the messaging. So prior to selecting a message type, the patient will have to obviously read and understand what the service is for. But then from that, they can communicate about a simple thing either way. And we can also configure these so that they appear to be chargeable to a patient as well. So noting that there is a cost. So you're not going to have that, free consultation back and forth. But we've seen particularly a lot of benefit for just those short communications for GPs where they're not having to do these appointments. It doesn't necessarily also have to be during business hours. So if a GP is working on a more flexible schedule and they still want to be, able to be utilized for this timing, or they're wanting to get through their admin in a different way, patients can communicate with them if it's appropriate, and GPs can respond in their own time. So again, we don't consider this service sort of an urgent care sort of response thing, and it's not going to be instantaneous. The comms on that are very clear to the patients, but obviously you can adjust these how you'd like. But it's a great way to improve that GP utilization because, yeah, again, they can do it in their own time. If they've got some admin or downtime and they just want to get through some simple questions from patients, they can do that. And obviously, you can still note that you're going to charge patients and then invoice them for it. Also, one thing that had come up in the past around duty of care and sort of obligations, we can configure it so that there is an out of office component. So if patients are looking to contact someone out of business hours, obviously, again, it is a non-urgent service, but we can make a note, for example, that if they send it on a Friday, the clinician will not be able to respond until Monday or the following business day. So from a sort of duty of care obligation perspective, we can cover those bases and make it very clear to patients what the service is for. And again, you could include things like an urgent after hours contact number or something in that out of office messaging. Cool. Jeremy, do you want to talk to the payment side of things?
Absolutely. Sorry, I was just on mute. Thanks for that, Isaac. That's very good. So in terms of payments within Manage My Health, we actually have a payment gateway built in. So we integrate directly with Tyro payments, and this allows clinics to be able to take payments online. So a couple of those areas would be online appointments. So you can have your appointment set up, your appointment type set up. You can have your standard consult, your long consult, any procedures, that sort of thing, and you can customize the payments that the patient needs to make at the time of booking for those appointment types. This just allows you to reduce no-shows, ensure sort of consistent cash flow, make sure those payments are coming through. Another area where payments can be made is with those repeat prescriptions. So if you've got patients that regularly need to top up scripts or come in to get new scripts, they can order those online. And at the time of ordering them online, they can pay online. So just on the right hand side, you have the option to turn these online payments on and off, but you also have the ability to offer the patient flexibility. So you can say when they're booking the appointment, they have the option to either pay a health center or pay online, and they would just enter their credit card details, and that payment would come through Tyro. Yeah, that's pretty much it for payments.
Cool. One thing I'd just add, probably Jeremy as well, if you jump back to that payment slide. So, one thing to consider in the medical context is if someone doesn't pay for something like a script or an appointment, it's very challenging to have those discussions. And also, there's an obligation of care in terms of you have to continue to provide medical services to someone that needs it. So, one of the key benefits we've sort of seen in the New Zealand market is by promoting people to use it, and sometimes at a slight discount, using the online services and collecting payment upfront, it kind of pushes these discussions earlier on before they snowball around why someone might not be able to pay for a service and kind of the challenges they're facing. Because if they can't, if you make the only option to pay online and they can't do that, they then have to call. And then you can have that discussion of, hey, well, why aren't you able to pay? What's going on? And then potentially you can help them access support services and prevent that from happening in the first place. And we've seen for a lot of clinics, it's massively decreased their sort of outstanding patient debt because they no longer have to spend all this time chasing debt. And also the challenge of, do you collect on debt? If it's $100, 150, if you've got, 50 people with that debt, it adds up and it's a lot. But it may not be worthwhile chasing each individual person because the cost of chasing the debt outweighs, the actual money you're going to get back. So we've seen a real benefit there in terms of changing the way that people kind of interact with the health center and the way that they go about it. And once you make it kind of the normality and people get used to it, there's no challenges. It's very much the same as, online shopping or any sort of online purchasing process. It's seamless and it's really straightforward. So there is, again, no excuse for not knowing how to use it. But, the benefits from an admin side of things are really, really good for clinics.
Absolutely. Yeah. Thanks, Isaac.
All good.
All right. So in terms of Manage My Health and our feature sort of roadmap for the future, for the next 6 to 12 months, there's quite a bit of work we're doing just to improve the product based on what's already there. So a couple of those points I've listed on the left-hand side have got things like patient management, where we want to improve patient auto registration, new patient registration. So the patient being able to come in, scan the QR code, fill in the details and add themselves in directly into Medtech Artia. Digital intake forms and enrolment workflows. We're building out a form builder so that you can actually have those forms as part of the new patient registration, and those forms just right back into Medtech straight away, so that you've got a record of everything from the moment the patient comes into the clinic, as well as bulk billing consent workflows, so that you can have automations around that bulk billing consent. That process can be digitized and sort of automated there. In terms of clinical and admin automation, again, just consent forms, that form builder we're building out, but we're working pretty hard on smart recalls and reminders through Manage My Health, so that patients are getting reminded by email, SMS, and whether it's clinical reminders or just appointment reminders. We're really looking to reduce those admin-heavy tasks for the clinical staff there. And further into the future is integrated AI tools. So we're looking into AI-assisted workflows, AI receptionists, but also another feature is just the flu vaccination clinic. Some feedback we've had recently is come flu season, clinics will often have maybe 10 or so patients booked into one actual standard console. And that's where we're looking to improve that workflow for either drive-through sort of flu vaccination clinics, or high volume sort of flu vaccination clinics. Yeah, and that's it for the future roadmap. So from here, what you can do next, if you want any further information, you want to reach us, you can use the QR code on the screen, or the link here. You can reach out to us, book a demo directly with myself, and we'll connect and run through things in a bit more detail. Or at the end of the slides, I've also got my email address. You can email me directly and we can go from there. But I haven't seen any questions come through, but we've got a few moments here for a Q&A. If anyone wants to throw anything into the Q&A, I think down the bottom of the screen, you'll have a little Q&A box. You can type in a question, and we can answer any questions you might have. We'll give that a minute.
Yeah,
Great. Thank you, Tim.
Anyone attending as well, if you are watching a recording of this, obviously Jeremy will have his email on screen, I think one of the previous slides, so feel free to email through any questions that you've got.
Absolutely. Yeah.
Cool. So I think just to wrap this up, probably some final words from me is if you think about what the most valuable resource, I assume for most people is time. And I think the key benefit of Manage My Health, not only probably for yourself, but also for your clinical staff, you're giving them back that resource. You're giving them more time. And I think, having more time means that they can spend more time, providing quality clinical care or doing administration that is valuable. But, having this stuff automated and putting this on the patients to kind of manage themselves, obviously in the saying of Manage My Health, is a much better use of time for everyone, not only for patients, but also for clinical staff. So I think if you're on the fence, definitely reach out to Jeremy and just have a no obligation chat and just see how Manage My Health can work for you and kind of give you back more time.
Yeah, yeah, and one point I did forget to mention earlier there was obviously Manage My Health is a patient portal, integrates directly with Medtech so that the patients can access the clinical information, but they can access it on the web. But we also have a mobile app directly for the patient, so it's simplistic to use. Anyone who has a phone uses apps these days. They can access all that information through the app, manage their appointments, see the clinical information, and then contact the clinic through the app. Yeah, and that app at the moment it's a web-based form, but we do have the app for Australia coming in the next couple of months.
Brilliant. Okay, we'll just give it another minute, see if anything shoots through. Otherwise, we'll look to wrap up. And again, any
Absolutely.
questions, shoot them through to Jeremy. And thank you very much for everyone who attended. I really appreciate you
Yes.
guys taking the time out of your day to join the webinar.
Yeah. Thank you very much.